Thank you all for having me, one, and two, thank you for patience while Jasmine is setting this up for us. But I will talk a little bit about what I do. So, as I mentioned before, I'm a birth doula and a childbirth educator, and a Medi-Cal provider. I'm the owner of In the Waiting Doula Services, and I've been a certified doula for about 6 years and then 10 years as uncertified. My mom was a doula as well. And so I kind of took the lead when she was serving. And I used to question her like all the time, like, why are you always taking off all to all support all these families and these moms and cousins and whatnot? And little did I realize it was her passion to support women. And I believe in empowerment. And so that's what I started doing as well. I am also not only the owner of In the Waiting Doula Services, but I am the founder of the Bakersfield Doula Circle. Um, that will be the second slide. The Bakersfield Doula Circle was something I founded and created when I realized that doulas did not have like a support or people that they can go to share, um, ideas with, or just it's just a doula network just to support one another. We used to have one many, many years ago, and for some odd reason, it did not take off. And so I said, hey, in order for women to feel like they have questions or things come up, we need support ourselves. So I created that. And as of March, myself and two of my colleagues, Marisol Ramirez and Raven Thomas, are the co-founders of Three Moon Doula Collective. We are the first doula training in Kern County as of right now. I'm also a certified Hypno Babies educator. And so what that means is I teach moms and partners of how to birth with hypnosis to have a more comfortable birth and to help them. There you go. I'm one step ahead now. Um, and I'm also a certified VBAC link provider as well, an educator, and I help women who have had previous cesareans and need support through trying to attempt for a vaginal birth after a cesarean. And so I've also trained under the following organizations: Doula Training International, Cornerstone Doula Trainings, Hypno Babies, Herbal Doula, and Birth Keeper, and VBAC Link Doula. And I'm currently training with BirthWorks International. Um, if you can go ahead and move that screen.
Can you see the next screen?
I think you just need to click on like the third slide. Just click on that third slide because I don't think it's letting you move forward. There you go. I think that's what you're gonna have to do is just click on the slide and that it'll work out. So, thank you so much, Jasmine. So what is a doula? There's many functions that we function under. There's birth doulas who support individuals during pregnancy, labor, and delivery. We provide education about childbirth. We help create a birth plan with the parent, and we offer physical and emotional support during labor. You also have postpartum doulas, which assist with families in the postpartum period and the newborn care, breastfeeding support, emotional well-being, and household adjustments. So maybe they might have another babe at home, and they have that, some moms will feel like, I need the help with this other babe while I'm, currently breastfeeding. We help, engagement with that babe as well. There's also full spectrum doulas, and they offer support across the reproductive journey, including miscarriage, stillborn, abortion, adoption, and surrogacy. They are well-rounded. They also, and I forgot to put that in the slide, they also help with fertility treatments. So say that a mom is having a hard time with maybe PCOS or endometriosis, full spectrum doulas can also help with a fertility journey. Um, and then they have specialized doulas, which some specialize in areas like bereavement, fertility journeys, and specific cultural practices. Next slide, please.
Yeah, I don't think
There
it
it goes. Right there. So what a doula is not, what we are not is we are not a medical professional. Um, we do not perform any clinical tasks such as fetal monitoring, vaginal exams, or we do not catch babies. We don't deliver. That's not within our scope. We're not a replacement for the support team. So say um, birthing person has a partner with them or a mother, and we don't replace their role. We are not there to take over. We are there to partner with them. So usually when we do prenatal visits with the parent, we usually let that partner know, whoever is going to be part of the support team, say it's a two-person, say it's a mother and a partner, we help them engage on like how we will tag team. So that's a really important thing because a lot of partners feel like, oh, we're there to replace them, and we are not there to do that. We are not there to take over their role because we weren't there to make the baby. So it's important that they're engaged as well. And some of them have fears. Some dads have complete fears about how do I engage? How do I support? Most, back in the days, like there were people who were birthing and dads weren't allowed into the room. And now dads are allowed in the room and we want them to participate. Even if it's just holding mom's hand or, putting their hand on their shoulder or just giving them words of affirmation. So that's really important. Doulas work alongside with partners, again, with support people. We are not responsible for medical decisions. So they may ask for advice. We can encourage like we went over the options. What do you think is best for you and your body and your baby? It's making sure that the client is taking full responsibility for them and the well-being of their child and their partner as well. So we don't make any medical decisions. We can give them handouts or pamphlets on medical interventions that they might need to take. And we will support those decisions no matter whether we agree with them or not. It's not our body, it's their body, and they have full control of that. A doula also provides the information, the emotional support, and advocacy, but we don't give medical advice again or make decisions on their behalf. Go ahead and go on to the next slide, please. There you go. Thank you. So a doula versus a midwife. The aspect, the training, the roles, the services, and the teamwork. So a doula is, as I said before, we are non-medical. We're focused on the emotional support. We provide a non-clinical support, emotional, physical, and educational. And we work with the family and the healthcare team. A midwife has medical training in prenatal and birth care. They provide clinical care, monitors health, prenatal care, delivery, and postpartum checks, and they may serve as a primary care provider in the event that they are not going to an OBGYN. So there's that. They do all the heart monitoring, the blood pressure checks. They are the ones that make the informed decisions for any kind of medicines that the client may need. We do not do that, and we cannot make those decisions. We stay within our scope. Go ahead, next slide. Thank you. So new benefit to Medi-Cal. I'm so excited to share about this because once we found out that doulas were covered under Medi-Cal, I think it was back in 2023, I had a little bit of a hesitation because of not seeing the value of what they were wanting to pay doulas. So I waited for a year and they did increase the rates. And I was like, you know what? We're going to help mamas. And I signed up, I believe in March, and I was approved um, on March the 3rd. And I partnered immediately with Kern Family. They were the first. MCP that I wanted to sign up with, and I really, really love their flow. I love their support and their training with doulas. That it was really important to me that I signed up with an MCP that was going to be there for us and be there for, Kern County. And so now we have birthing people who would not ordinarily be able to afford doula services or pay in cash or pay long stints of payments because sometimes we do a sliding scale for these clients. And now, because of Medi-Cal, it's still a learning curve. Some people still don't understand what doulas are. They don't understand how we can be there for them during their birthing time. And it's a great benefit. And I've encouraged Marisol and Raven to join the team, and they are in the process of being certified through um, Department of Human Services. I'm sorry, Department of Healthcare, and to get contracted with Kern Family. The improved outcomes studies with doula support is we decrease it by cesarean births by 25%. The epidural use by 60%, because if you have someone constantly reminding you that your body was created to do this and you can do this, um, moms tend to be more like open to delaying getting the epidural or even using the epidural. Um, and the overall labor time by 30%. They are likely to stay home a little bit longer until they are in active labor and go to the hospital and then ready to birth their baby and not be there for so many hours, just waiting. And both of these people here they have signed releases. They are my clients that were as of 2024, and both of them were under Medi-Cal, and they actually loved the support that they had during their birth. And so I did get medical photo releases from them to make sure that I can share this on here, so they're aware. Um, so the community impact with Medi-Cal doulas is that we help normalize doula services for essential care for all families. And I've come across moms that, didn't know that doula services were available. Now they're like, wait, I don't have to pay. My insurance is going to cover this benefit. It brings them to their knees, like realizing that they can have access to a doula and be able to have the support and prevent them from dying in birth, prevent them from being coerced into something that they don't want. Most of the times women, we just, we hear it and we're like, okay, I guess that's what we need. And sometimes they're in fear. A lot of women that I interview with, they are constantly telling me that they are afraid they're going to die. We have a high rate of women dying in Kern County and throughout the US. Black women are dying at a way higher rate than any counterpart. Um, they the rates are really, really high. I don't have that here, and I wish I would have put that in my slides, but a Black woman is much likelier to die in birth than any other race. Um, and then we've had in Kern County, the list grows, but we've had three maternal deaths here in Kern County of Latina women. Um, and I co-host with a mom who had lost her daughter here in Kern County. Um, every year, the next one, it's a Latina Maternal Health Fair, and we'll be hosting that at CSUB on May the 2nd. Um, and it's to inform people about preeclampsia. Um, Many women are dying from preeclampsia or high blood pressure. They're not even knowing the signs. They're asking their friends, and those are not medical providers. We are not either, but we can at least tell them like, hey, contact your OB and let's see if they can get you on, some form of baby aspirin or something to help you We have also anemia that's really high in Black and Latina women too, that are struggling with anemia, feeling faint, feeling fatigue, not hydrating themselves enough. And that's super important. Every time I meet with a mama, I always tell them, how often are you drinking water? How often are you drinking? And then I will grab my cup, which I have on my desk over here. I'll grab my cup and I'll sip it, and I'm like, water is so good. Water is so good. It's super important that women are hydrated, and it's super important that they feel protected and seen. Most of my moms, and I wish I would have put out that there, that they write reviews on saying, if I didn't have you, I don't think I could have done this. I just supported my final birth of a mom that I've had for the past, I'm going to say 5 years, and I've been with her for three of her births. And now she's interested in becoming a doula. Um, the impact that she saw, she was like, I was able to go unmedicated for all three of my births, and I wouldn't have been able to do it without, having support. Um, Women were doing this before there were hospitals, unmedicated. They were, screaming, and we don't, we encourage them to stay calm. We place our hands on their shoulders if they are okay with consent and physical touch. There are some mothers that do not like to be touched, and that's okay as well. But they just need that affirmation to know that they are safe and that they are going to be okay. In the event that there's a change of plans, maybe they might need a cesarean. It's important to, because sometimes those discussions from the provider may come in really harsh or in an emergency state. Moms go in fear, and they are like, I don't want to be rolled back. And the provider's not going to stay in there longer, but doulas do. We're there to calm them, and we say, we're so sorry that this is happening right now. This is not what we had. I know this is not part of the plan, but I'm going to be here. Like, I'm not leaving your side. While you're back there, when you return, I'm with you. And we will discuss it. We'll talk through that emotional part, because most of them are in fear that they're going to die. And so what's the benefit of having a doula? Also, as of May the 1st, since I've been contracted with Kern Family, I've had the privilege of supporting over 22 clients in 6 months. Currently, there are 8 active Medi-Cal doulas serving Kern County, and I'm contracted with Kern Family Healthcare, Kaiser Permanente, and Anthem Blue Cross. Doulas are essential to the community. Next slide. And announcing a new business so that you are aware. I did mention it in the beginning, but Three Moons Doula Collective was founded in March 2025 by myself, Marisol Ramirez, Raven Thomas, to address the need for accessible, culturally relevant doula education in Kern County, California, rooted in the values of birth justice, reproductive advocacy, and community-based mentorship. Three Moons Doula Collective offers in-person training that uplifts aspiring doulas, particularly those from historically undeserved and BIPOC communities. And if you don't know what BIPOC is, it is Black, Indigenous, Person of Color communities, through hands-on learning, cultural humility, and deep commitment to care. Three Moons Doula is building a more just and compassionate birth landscape in Kern County and beyond. So this is a new business venture that us three have taken the lead on, and we noticed that we have to train in different places, and usually they're in other states or they're virtually. And Kern County, we said, you know what, there's no one here. And we are experts in our field. We've been doing this work for quite some time. Why not create a training ground here and help mentor, shadow, and encourage young new doulas who are aspiring to become doulas, because we need it. We need a lot more Spanish speaking doulas right now. We have about, I would say, about 26 active doulas in the community, but there's probably about two or three Spanish speaking, and only one is in the process of certifying, and that's Marisol. Um, we are trying to train uh, Spanish speaking doulas, Black doulas. We need more. We need more doulas to meet the community needs. Um, and that is that. Um, Time for questions and answers. Do you guys have any questions for me about what doulas do or anything?
And before we go to that, is it okay if I stop sharing to admit a few more attendees?
Oh, yes, please.
Thank you. I don't see any questions in the chat. Did anybody have any? I know a lot of us on this call serve the Medi-Cal recipients. Any questions on how to maybe refer our participants to a doula?
I had a quick
Ashley
question
has a
too.
question.
Yeah, thank you.
I'm like, I see Ashley up there. I've seen her a few times. Hi, Ashley. How are you?
Hi, it's good to see you again.
Good to see you again.
Just a question. I know every doula who's well, anybody that's accepting patients, whether it's Medi-Cal or not, you guys kind of set your own pace as far as like how many prenatal visits you do or postpartum. I know that the number of postpartum visits expanded. Can you just explain a little bit about like what your guys' typical process is for how many visits you do prenatally and then what you do with any postpartum visits?
Yes. So you're asking specifically regarding Medi-Cal, correct? Okay, so Medi-Cal gives us 9 prenatal or postnatal visits, so postpartum visits. We can use them in conjunction to depending on either how early or how late the client hires us. So we get 9 of those, and then we have the labor and birth, and then we have 2 3-hour postpartum visits. Um, Quite honestly, this is not something that can happen here in this forum, but there's definitely a need for more postpartum. They can ask their provider to sign off on a recommendation letter to get 8 more visits. Um, I don't think those are enough. We see a lot of moms struggle with postpartum depression. We cannot fix their mental health, but I do refer one of our Medi-Cal, she's now a Medi-Cal, accepting insurance for mental health. So I wish she was here because that would have been a great, segue to let her know. It's Ali Brambilla. She offers mental health services. I believe her business is called Abundance Healing. She is the only one that accepts insurance through all insurance. And it's very rare for a mental health professional to accept insurance. A lot of them are cash paid or, credit card, or they do a super bill. And she's the only one in town right now that accepts. And I've already referred 2 of those clients to her, and she's like, "Oh my God, thank you so much for those referrals because they really were struggling with mental health." And I'm like, "Yes, we need women not to struggle." Some women after birth, they lose a little bit of their identity of like, who am I now? I was Nikki here, and now after birth, I don't know who I am. So they're trying to search for this new identity. And so there's a little bit of a loss there that happens. I know culturally, as an Indigenous person, we have, and this is not an offering through Medi-Cal, but we do have an offering called Closing the Bones that I offer, and it's a wrapping them from head to toe in like rebozos. It's a Mexican shawl that wraps them from head to toe, and it makes them feel like they come back to themselves. I don't know how to explain it. It's a more of a spiritual explanation. But most moms that are on Medi-Cal say, "Hey, can I get that service?" I'm like, "Not through Medi-Cal, but if you want to pay for that service, I take it as a donation based. And then if you want to do that, we can do that, but we can't claim that under Medi-Cal." And they're like, "Yes, let's do it." And every person that has taken up that opportunity, even my cash paying clients, have said that it has really transformed them. It made them feel like God was giving them a hug. Yeah. But yeah, we need more postpartum. I think there should be longer postpartum services. So I normally meet with my clients six, 5 or 6 times during prenatal, and I try to use the rest for postpartum because then I'm like, oh, you get a few more hours postpartum. I stay with them normally about up to 2 to 3 hours after birth, anyways, just so that they have a latching, they have that golden hour with themselves and then with partner, and then try to prevent like so many people coming in just so that they can enjoy that moment. This is the first time that they're getting to be parents, or maybe second or third time being parents again. And it's super important that they feel a connection and bond with their baby. Yeah. Thank you for asking, Ashley.
You.
Anybody else?
I do have a question. Good afternoon. This is Jessica with Current Family Healthcare. How are you guys doing today?
Good. How are you?
I'm doing good. I have a question. We get women that are in their beginning of their pregnancy, second trimester, third trimester, and we even get women that have already delivered. I know by what they have told us, they're able to get the doula services up to a year after their delivery.
Yes.
So even though if it's been 2 weeks from their delivery, we still can refer to you guys, right?
Correct.
Okay.
I will say though, there is an influx of more birth doulas than there is
Mm-hmm.
postpartum doulas. Um, we just have to explain the role of what we do because some moms, I don't know if they get confused, but they're like, "Oh, you're the nanny," and I'm like, "Nope, I'm not the nanny."
No.
Um, and it's not like, normally, like if there was a cash paying client, sometimes we do like a sibling care. But with Medi-Cal, we cannot do like a sibling care. Like there's no like babysitting or watch the kids while I sleep with baby. We can do partial, like, oh, we're there to take care of mom and baby. And
Mhm.
sometimes I get, the littles to engage as well. I'm like, come on, babes, come over here. Let's color, let's build blocks, and mom will be there watching. I'm like, you just bond and breastfeed baby, and you're good. You look good. Let me just like engage with babes so that they can, you know, not bug you because usually kids, they want to jump all over mom.
Yeah,
They
and
want to be around baby.
I'm not sure, but I think in our first meeting when we got introduced with the doulas at Kern Family,
Mhm.
you guys had mentioned that you guys were working on seeing what way, not like babysitting, but like when mom's delivering and if mom doesn't have any support or any family members that are able to take care of the other little ones, you guys were gonna try to do that. As
Yeah.
in, is there an update on that? I'm not sure.
That's more of a Medi-Cal, like coming from the state decision. I don't think that's something that we can do because what we were when we had that meeting at your
Mhm.
office, I believe that what we were trying to say is one doula would be servicing the mom while another
Mhm.
doula would be watching the littles in the event
Okay.
they had no, I mean, it's very hard to get in uh what is it? Community connections for some of these
Mhm.
moms, and they don't stay, I mean, community connections does not stay open 24 hours.
Exactly.
So that's a really hard thing. And some of these moms don't have families. Like one of my
Mhm.
clients that I supported, she had no family. I actually had to travel to her birth in Bishop because it was during Christmas. And she was like, I'm here and I'm in labor. And I'm like, wait, what? I got to drive almost 3 hours to you. But you know what? I support my clients. I'll drive wherever you're at. And she had an amazing birth. And
Okay.
like, yeah, I don't know if that's a us decision that we can make, and I don't know if
Okay.
that falls in the guidelines of Medi-Cal until we hear from.
Yeah. I think you guys were working on it, so I'm not really sure
Yeah, I think that
if
it would be a stakeholder decision.
okay. Okay,
Yeah.
and then can we get that information of the person that you refer that accepts all insurances for the behavioral health? Just in case if we need it. I mean, Current Family Healthcare does have a department for behavioral health that we're able to refer to.
Okay.
But just in case if we need it or if our members want to use them as well.
Yes,
Okay.
definitely. I will,
Thank you.
she was a previous client, so it's kind of funny. She was a previous client, so I'll have to get her office number. I only have her personal number.
Okay.
So I'll get her information and then get it over to you because everything right now is like we share on social media. Obviously, Facebook, there's a lot of mommies groups on there. And then we have Instagram that we share, forward stuff. So I'll get that
Okay.
information for you.
Okay. Perfect. Thank you.
You're welcome. Anyone else? Nope. Jasmine? Thank you so much, everyone, for letting me speak and be here and present what doulas are. Um, I know that the Baby Steps program at Kern Family has been doing an amazing job at referring clients over to all of us doulas. Every one of us doulas is, we have been referred by you. We have also been referred by Clinica Servista. Like, there's a huge influx from Clinica Servista. I get calls from them, I think once a week, and they're like, hey, we're referring a client to you. They're high risk, whatnot. And we go and sit with them at their doctor's appointments too. So if they need it, I mean, with high risk for Kern County, I mean, we're going to do
That's
it.
good to hear. That's good to hear. Yeah, we have been trying to um let them know about your guys' services, and we do have you guys listed in our community resources that we include with the educational material.
Mhm.
So we will be if we I mean you probably are gonna get busy. I mean we do contact members every day, so I mean
Yes.
we're trying our best to refer them over to you guys.
Yeah, we get a lot of referrals.
Like,
All of us
what
will
are
say, did you call that person? Did you call that person?
Nikki, I have a question. I didn't get to hear what are the ages? What's the youngest age that you go from?
Anyone who's covered under Medi-Cal. So I would say the youngest the person that I've supported, I've supported a lot of foster youth. I'm also a foster mom myself. Or now I'm in guardianship with my boys, but um I've supported I think 16 was the youngest.
Okay.
Yeah. As long as they're covered under Medi-Cal, they're good.
What are your hours for visits?
I adapt to whatever the client needs. So
Okay,
I'm normally open from 9 to 9.
9 to 9. Okay, that's good to know. Just because if they're working, 8 to 5.
Oh yeah, well, I know that we get I believe Marisol just got a client referral for someone who was a farm laborer, and so we know their hours a little,
Mhm.
hard. So we will take whatever they do. I usually adapt to their schedule if I can. Um and even if that means driving to them or they can come to my office. We are the only doulas right now that have a physical office. I've had an office for about 4 years, so I like when clients come here and, they get to like, run away from the kid, the other siblings. Get to like, oh, and when I tell them, do you want to come here or do you want me to go to your home? And they're like, can I please go over there? I got a babysitter. And I'm like, yes, please come here. Like, this is your time to like rest, be loved on, and be cared for. And some women, they just walk away saying, wow, I didn't know that. And I've given birth like 4 times. I have a mom right now. She's a six timer. And she's like, I didn't have this education. And now she wants to become a doula.
Oh,
So,
wow.
yeah. I'm like, yes, do it. You can do it. Like, you know what birth's like. And this time you're not going to run away from birth. You're not going to be afraid. You will not be afraid with our support. We're going to be there to support you. And if anything changes, we're here to help you. We're here to guide you. We're here to love you through the process and tell you that you're safe and that you're good. And usually when you hear a compassionate person protect you, you do. You automatically you're like, oh, this is a breath of fresh air, and now I feel protected. We're not there to fight with providers, like that's a no. Um, our job is to make sure that we are supporting our clients to the best of our ability and to make sure that they feel safe.
Yeah, that's very true. I mean, usually that's what even though we do it, we talk to them over the phone, but I mean, that's what we want them to feel comfortable with us, that they can not depend on us, but be able to contact us if they need the help, really help. So, and I know, and I want to thank you because I did refer a member to you guys, but I think I called 3 of you guys, and finally one returned the call right away. So,
Yeah.
and then I think I left you a message. You
Yes.
returned the
Yes.
call and everything.
I
So
was
I
out of
do,
birth.
yeah. So I do want to thank you for that. So I am providing that information to my mommies as well.
Yeah, and you know, all of us doulas that are contracted, we are so thankful that you do that because that you know, as a cash paying doula as well, you know, you'll get one, maybe two, like every 2 months. And with the referrals, we're bringing in a good amount of, support for these clients that normally wouldn't have been able to afford our services. And that's what the awesome thing about Medi-Cal, being a covered benefit for them. And they also, some of them are not informed, but they know. I know that some of your office will let them know, but that they can get rights to us or rights to their provider. They're some of them don't know that, especially if they're not high
Yeah.
risk. They don't know
Yeah.
that. um
Yeah.
the high risk people, they know a lot because they're like, oh yeah, I'm part of the Steps Plus program or the Baby Steps program. And I'm like, okay, yeah, we love them. And
Yeah.
so we
But
think.
yeah, if it's a contracted provider, and they have medical equipment, probably they should be able to use the transportation. And
Mhm.
if they have any issues, Nikki, you can contact myself, contact Alexis, or contact Araceli. One of us three will be able to help you out because they should be able to use transportation because it is a covered benefit through Medi-Cal. So
Mhm.
it should. I mean, I don't promise you that it'll be something efficient. I mean, but we do try to work the best to be able to get that Uber driver to, or the transportation that's available to be able to take them to their appointments.
Okay. I do have a
Okay,
question. I
go for
had
it.
a client just recently that she was, without disclosing too much, she was doing a termination. And the Bakersfield office does not do the termination to far into pregnancy. So we had to travel to Fresno. She did reach out to Kern Family to see if she can get a ride, before she asked me, can you meet me out there? And I'm like, Fresno, that's a little far. But I went,
Alexis, do you want to take that one? You used to work at Member
As
Services.
long as it's covered by Medi-Cal, we can take them anywhere. It
okay,
it could be Greyhound, mileage reimbursement, or a non-medical transportation vendor.
okay, I will contact her and let her know that because I mean it's already had happened, but
Mhm.
she had told me they can't drive that far. And I'm like, that doesn't make sense that they would not be able to drive out to Fresno. This is a benefit that you're needing at this
Yeah,
time.
by what we know, it should be covered. If there's issues like that, the best thing, if I'm not mistaken, right, Alexis, is to call member services and explain to them that they called
Mhm.
transportation and that transportation is saying no. Because usually what they have to go do, transportation has to call our member services department, and correct me if I'm wrong, Alexis, to get approval. And usually it's just very little things. Verify if they are scheduled with that
Mhm.
provider out there in Fresno or in LA, wherever they have that appointment scheduled. They member services just has to verify
The
and make sure,
information.
yeah,
Mhm.
and make sure the date, time, and everything. So by my understanding, it shouldn't be a mistake. And Alexis used to work at member services. She comes from there, so she's pretty familiar. And I always go to her, not to bring her out in the spot, but I always go to her just to make sure my understanding is correct. And by what I know and what Alexis says, probably the Uber is not available, but we have other contracted companies that they are able to use, and it just has to be approved by member services. Or I mean, if we can help, we'll butt in a little bit if we have to.
Okay. So should I have her contact you regarding the mileage reimbursement?
She would call
Yes,
transportation.
transportation. It would have to come through
Mhm.
transportation. They will just mail out the mileage reimbursement, right, Alexis?
Yeah, and she can also visit our website as well, and it's on our website, the forms. If you go to the search, she can just type in mileage reimbursement forms and they'll be on there, and she can just print them. If not, she can call transportation and we'll mail it out to her. And I could drop the number in the chat. Um,
Okay,
if-
perfect. Perfect.
Also,
Pause.
I had a question. I'm so sorry. For
Yes.
that Latina Mental Health Fair for May 2nd, how
Or
do
May
you,
3rd. I'm
or
sorry,
May
May
3rd?
3rd. Yeah,
May
May 3rd.
3rd? Okay.
That's at CSUB at the Runner Cafe.
Runner Cafe. How do you enroll?
I think
Is
you
it
guys
open
are
to
already set
public,
up. I think you guys are already set up, but yes, it's open to the public. It's free.
even for like our members? Oh,
Yes.
okay.
Yes.
Would you
Um,
have a flyer?
I can email you a flyer.
Yeah.
The mother who is doing it, her daughter died, I'm gonna say about three or I want to say 4 or 5 years ago. Demi Dominguez, I don't know, she was probably all over the TV when she had died due to medical negligence.
Okay. Thank you.
You're welcome.
I know what I'm doing now.
Thank you. Thank you so much, Nikki.
Excuse me, could I just butt in here? Just, Nikki, could you email that to Jasmine and Jasmine could email it to all of us?
Yes.
That would be
Was
nice.
that Janet?
Thank you.
Thank you so much, Leslie. Nikki, if you could please email me that flyer. Anybody that has events going on, email them to me and I'll email them out to everybody in a blast email. And I want to thank again, Nikki, for presenting. I think that was great information, great questions, and we still have another presenter. So please, if you have those questions, type in the chat or save them. But I'm gonna go ahead and share my screen. Can you all see my screen?
Yes.
Hopefully it works better. I'm now at a desk that has dual screens, so please let me know if you can't see my screen anymore. But Miss Marisol, the floor is yours.
Hi, everybody. Thank you, Nikki. I wanted to say thank you for inviting me to this presentation. I am also a birth doula. I am actually new to Bakersfield. I moved here in 2021 from Los Angeles, from the South Bay area, and I was a birth doula there as well. When I came here, I didn't know anybody. Nikki was the first person that I met. So thank you, Nikki. She's been a guiding light for doulas here in Bakersfield. I am also a new Medi-Cal doula provider, and I am waiting for my enrollment for current families. Hello. And I also studied to be an assistant midwife at the farm in Tennessee with the Farm Midwives. And I am a co-founder with Nikki and Raven of Three Moons Doula Collective. Like Nikki said, we're really excited to be able to use all three of our expertises, and they're very diverse, to help train and get new doulas to also sign up for Medi-Cal here in Bakersfield and Cook County, really, especially Spanish-speaking doulas. Next page, please. So like I said, I'm a birth doula. I'm also a parent of a 30-year-old and a 23-year-old. Actually, my 30-year-old is watching me right now. Hey! I'm also a foster parent, and we just recently adopted 3 little ones that came to us through foster care. I am LGBTQ, and I am a first-generation Colombian American. And I started my journey into really trying to delve into lactation because a particular client was having a lot of challenges, and I felt so inept, and I just was like, she was knowing more things than me because she was really trying to find support for herself and to increase her milk supply and find out what was wrong, why couldn't she make more milk. And so next slide, please. So why does having a doula help lactation? So like Nikki said, we do offer the emotional and physical support before and during labor, and then also after. We have a lot of our prenatals have to do with comfort care and such, but I really am an advocate for doing a longer lactation course because there's so much about lactation. It's not just about positioning. There's so many things that can arise. And so I try really hard to fill in the blanks. And also, we lower the rate of C-sections. So, and then we can facilitate better lactation after C-sections. We can also, the likelihood of both starting and continuing breastfeeding up to 15% higher than if a person didn't have a doula. So it is increase percentage of lactation people lactating for longer. Next slide, please. So like we said, increase breastfeeding initiation. I usually stick around for a lot longer than most people. I encourage latching as soon as possible once baby is born. And also, there are studies that have shown that women who are birthing people who have a doula have a frequency of breastfeeding longer than 6 weeks, and maybe up to 8 to 15% higher than normal normal people who didn't have a doula. Next slide, please. This is actually a client of mine, and like I said, I really encourage latching immediately. A lot of times during our lactation portion of our prenatal, we do a lot of explanation of hand expression, why that's important, and obviously, the initial lactating colostrum happens shortly after the placenta is born. So in the hospital, they do see actual proof that milk is coming, and that is great. Next slide. So when we're teaching, we always talk about what we know. Like breast is best, feed 8 to 12 times in the first 24 hours of birth. Hand express to bring forward the colostrum. If baby has low input, it means that output, it means the baby's not eating enough. It shouldn't hurt. It must be an incorrect latch. And this is hard for a tired person who's had a long, uncomfortable time in labor and then goes home alone with no other support. Maybe a partner who has to go back to work, maybe a grandmother who is also at work or lives far away, and that could be detrimental. Next slide, please. What can cause low supply when parents get home? We are seeing a lot of postpartum stress over not making enough milk. How do I know why? I'm just going to pump. I'm just going to formula feed. There's a lot of those conversations happening over the phone, and that's where doulas being able to home visit after for more than just 2 visits would be great, like Nikki said. Next slide, please. Okay, so common barriers to successful lactation, right? For parents is, right, being tired, fatigue, and lack of overnight support. We're having to feed every 2 hours about, right? Undiagnosed hormonal imbalances like PCOS, thyroid dysfunction, significant blood loss postpartum. Really, a lot of hemorrhaging is happening. I've seen more hemorrhaging in the last 4 or 5 years since COVID than I did prior. I think a lot of that has to do with the rushing of the expelling of the placenta. There's I'm watching a lot of doctors pull on the placenta early on. And I'm watching a lot of things happen with doctors wanting to induce early. So it's not fun for us doulas to watch happen, obviously. But the also exposure to high levels of pain medication, the Pitocin. Pitocin, I actually had a doctor who didn't know that there was a study that high doses of Pitocin can delay lactation. There's also a lot of gender affirming hormone therapy that affects lactation and physiology. So there may be a lack of breast tissue, or hormones that were taken caused an imbalance. And so that partner was not able to, or had very little milk supply. And maybe a previous breast augmentation. So if a person in their early 20s maybe had a breast augmentation, they didn't know that the fact that the surgery site had a specific nerve that if damaged could cause the nerve to not send the signals to the brain that can delay or not cause enough supply for baby. So infant related factors, unrecognized oral ties. I'm seeing a lot of lip tie, tongue ties. And so baby is having a hard time latching. And then prematurely resulting in underdeveloped facial. Okay, so a premature baby is usually born with a lot less fat than a full-term baby. And so the fat in the cheeks helps with the sucking. And so if mom didn't know that, that can cause issues with suck swallow reflex. And then external challenges, lack of social practical support, like having to go back to work really quickly. And like we were talking about earlier, we have quite a few farm workers who really need to go back to work. And I don't see how they can offer a workplace environment for moms to pump and then to store their milk. So moms are not being able to pump during the day and maybe only chest or breastfeeding during the evening hours. And that is a stress. And then family pressure to introduce formula prematurely. I literally had a family recently just tell the young mother, give it up, just give it formula because I want to feed the baby. So there's a little bit of that. And then we have the anatomical minimal breast tissue development. It is called IGT. And insufficient glandular tissue is something that when I was learning about lactation, I wasn't taught this until recently. So I wanted to share. Maybe the people here who are current up to date in lactation know, but let's talk about it. Next slide. So insufficient glandular tissue. There's just some physical indicators. There's no real tests. So the physical indicators be a widely spread breasts, minimal breast growth during pregnancy, impaired milk production despite proper breastfeeding techniques. So even though they're doing everything, they're latching, the baby's latching, baby doesn't even have a tie after the 3 days, and after they come home, they're having low supply. And then reduced prolactin receptor activity due to insufficient breast drainage. So there's just not enough production in each gland, and so the breast is just not draining. So diagnostic challenges. There's no definite diagnostic test that exists. So there's not like one thing that you can go to the doctor for and get a blood work for or anything like that. There's just an assessment, and it's like evaluating a breastfeeding history. So did you breastfeed before? Were you not able to breastfeed before? Is this your first time? Exclusion of hormonal imbalances, also deciding or figuring out, is there hypothyroidism, PCOS, insulin resistance, or pituitary dysfunction? Obviously, those things are a factor in IGT. And also observation on congenital hypoplasia. Basically, just no tissue, very low tissue. And then clinical implications. Many cases remain undiagnosed because this is not something that lactation people or supporters consider, or maybe even pediatricians or general doctors talk about. They think it's their fault. Parents think it's their fault. They did something wrong. They slept too long. They didn't eat the right things. They didn't hydrate. It was their fault. And so maybe they felt like, I'm just going to have to triple feed. And then the triple feed can lead to just going to straight formula. And then all their dreams of breastfeeding go down the drain, and then they go through the grief and the guilt. I definitely know how that felt. And actually, this picture is a picture of the person's milk who I was speaking about earlier. This baby, if you can see, the baby is about 2.5 months, and that's all she could get. And she was very, 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 very adamant. She worked very hard, and that's all she can get. So later on, this is where I feel like she maybe had IGT. And of the 5 practitioners that she saw, no one could tell her that this might be a thing she had. Next slide, please. So supporting parents in achieving their feeding goals. Assessing parents' preferences. Does a parent wish to continue triple feeding or transition to lactation, a lactation aid system where they're using formula or donated milk to through a little tube, taped to their breast, and still having the baby latch to the breast to feel, for the baby to feel that comfort, for the mom and the baby to have that bond. Or optimize milk production, encourage pumping during peak prolactin hours between 2 and 8 a.m. to support the supply. Apparently 2 and 8 a.m. is like peak. Obviously, other numbers are from 2 a.m. to 2 p.m. So then maybe encouraging mom or lactating person to pump between 2 and 8 a.m. and be able to rest better at other times of the day, or even the night, I mean best. And then number 3, evaluate support systems. Discuss available support to manage fatigue and sustain efforts. Obviously, it'll be a team effort for the whole family to help if parent really, really wants to continue to make milk for their baby. Reassess feeding strategies after 1 week. So from my understanding, trying all the things should only last 1 week. If trying breastfeeding during certain hours, or triple feeding, or super pumping, or all these things don't work after trying each thing for 1 hour, then maybe medical intervention will have to take place. And that would be maybe contacting a doctor to get oxytocin nasal spray, or get medication called domperidone. And those are 2 medications that, from my understanding, are rarely prescribed. And my client there, who we were speaking about earlier, had to get hers from Canada, sadly. Maybe it's different now, but as of like 4 years ago, she was only able to get it from Canada. and then recommend additional support a postpartum doula can provide, and amazing assistance during this challenging time. So I have been with parents who decided overnight that they were going to quit, and then called me, and I ran over and helped them get back on track and set them up, set up their breastfeeding station, set them up with their snacks, set them up with hydration, set them up so they feel comfortable, and continuing and obviously encouragement as well to continue their goal to breastfeed. Next slide, please. So in conclusion, obviously there's multiple factors such as physical, hormonal, social, and environmental that can impact lactation. And every parent's journey is unique. Understanding and addressing barriers empowers better care. I think that better care means having lots of options, having lots of providers in Medi-Cal, or just the regular doctors to be able to say, hey, let's try this, let's try that, go see this person, go see that person. And if the parent really wants to continue to lactate, to try everything as much as possible. Definitely, I'm all for obviously lactating, but we want also what's best for the mental health of the family and of the mom, of the birthing person. And there is a book that can help with the grief of not being able to lactate, and it's called Healing Breastfeeding Grief by Hilary Jacobson. And I'm hoping that, I don't have to prescribe that book for very many people, but I know that that would have come in handy for a few of my clients and myself too. Does anybody have any questions?
I think I have a question because I know when I go to homes and I get those many questions, there's when moms come home trying to figure out how to latch, and I know I'm not a professional in that area, so I know I've already reached out to Jasmine, I've reached out to Baby Cafe, so I'm familiar with all the different places. But what is it exactly when you go to the home? What's the first thing that you do? How to help them? Do you have them first kind of latch onto their baby so that way they know? It's kind of like to make them feel secure. How do you get them to feel secure? Because I know there's moms that still they're a little bit embarrassed, breastfeeding in person, or they're at home still when somebody comes into their home, they don't know.
Well, if I was their birth doula, I've already seen everything. So they're usually not embarrassed. But if I'm just coming as, their first time meeting, I would probably assess the room, right? Assess who's supporting, what are their intentions, where do they sleep? Where does baby sleep? How can we organize their environment to where it would support them breastfeeding, right? Do they have enough support and pillows? Are they in pain? Like, what's their pain? Do they need pain medication? Would that be helpful? And then probably just slowly work into, when was the last time you fed? How did it feel? What are the feelings that you're feeling about how that went? Sometimes they admit that, they just got so frustrated and they gave formula. And I definitely don't go into judgment mode. I'm like, that's good. Feed baby first and then collect yourself to figure out what we want to do. But everybody's different, so I just kind of assess the situation. And if this is the first time I'm seeing mom, I'll say, okay, let's look and see how you would do it. And so then once I see how they're doing it, I would maybe make some suggestions for corrections, obviously politely, and because it's such a tender time, it's such a vulnerable time, that don't want to say the wrong thing, right? You're obviously, you never know what you can say, and I've definitely stuck my foot in my mouth lots of times, but I try very hard to just make, maybe like this hold would be better for baby. Maybe baby just doesn't like that hold. Um, and if it was a family that I had already, supported through birth, they probably already got the lactation course and they probably saw the videos I sent them. And I will say, remember that video? Remember when we did hand expression? They're like, oh yeah, yeah. And so then they'll have them do hand expression, show them that there's milk. Okay, now leave some milk on your nipple and then let's get baby to latch. If there's already milk there on the nipple, then on the areola, then baby will, taste it faster and milk will come faster and baby will want to latch better. I definitely watch for noises and watch for how baby is reacting. And a lot of times I've been the one who said, I think you probably should see the pediatrician. I think maybe baby has a tie. And sometimes a hospital pediatrician, misses it. There are a lot of teaching hospitals that have just quick runs, pediatricians are just coming like in and out, just like whatever, fast. And so I definitely, just like that. Does that answer your question? Or is there?
Yes, yes, it
Yeah,
does.
yeah.
I just wanted to know because kind of like my way of telling them, it makes them feel secure that whoever I refer them out to, that they feel it's going to be okay, and kind of just to let them know, okay, this is how they're going to get started, so that way they're a little bit more informed. It's almost like when you give that child that between stages of what you're going to do, like we're going to go to Aunt's house, I'm going to give you 5 minutes, so I'm just trying to prepare them for you if I do the referral out. So just wanted to make sure. Thank
Yeah,
you very much.
a lot of times, we weren't raised, our culture is not raised around a circle of women who are all hanging out breastfeeding. So I think most of the times we think that baby just, knows what to do. And if they didn't have like a lactation class, then they just, the baby latches on and it hurts because, baby doesn't get a full mouth of areola. So there's a lot of education, and that's why I work a lot with Nikki and some of her clients, and she's like, hey, can you please help me with this lactation class with this family? And it's because I'm like really passionate about it, and I want them to succeed so bad, right? And when we're talking about like the insufficient glandular tissue, like that's not anything that they could help, really. Some people are just born with less glandular tissue, and we don't know that. Like it's like they didn't know that ahead of time. So they could be really like struggling day and night and day and night, and they're like, it's just not enough. Baby is just so hungry, and I'm not making enough. And that's where it just becomes very sad. It's very sad for the family, and they just quit and they don't tell anybody. They don't tell the doctor. They don't tell, the pediatrician. They just like, oh no, I just, I went to formula, because they feel bad. They feel bad that they felt like they failed, So, like I said, I didn't know about IGD, and so I'm really happy now that I know, because I'm in a situation where I can say, if I've seen this family for 2 weeks and and there's still not enough supply to sustain the baby's growth, then for sure there must be another underlying issue that maybe, if parents really want to address, can be addressed by their doctor, And so we can say, hey, this can be addressed by a doctor. Why don't we get an appointment and try to do that, right? Instead of just quitting. Or they can, do both, formula and breast. So it's just, what I'm trying to do is just create a lot less trauma, both in birth and after. We want every birthing family to have a child with no trauma, and then that child grow up knowing that they had this low trauma or no trauma birth, and they feel like, oh, birth is happy. It's not a crazy emergency. It's not scary. It's not, it's not the way we see it in Hollywood movies, right? So we just want everybody to have a peaceful, blissful birth, you know, and so we can have another generation of people with less trauma.
I was gonna just chime in really quick on um, with that, with her helping me with my clients that are new moms that want to have a successful breastfeeding journey, having access to Medi-Cal and doulas, I think is super important because they're going to get that one-on-one support where we're in their home for postpartum, maybe up to 3 hours, where normally they can't travel, they just had their baby. So having that in-person support through their postpartum journey is super important. So I love, Rosalia, how you said that you needed it for like referrals and how to referral. That's knowing that, say, like a client doesn't use a birth doula and they just need postpartum services, there it is. That doula's covered. They can spend so many hours with them, helping them, and other things come up. Because when you're talking to mom in postpartum, there are so many things more that come up besides breastfeeding journey. It could be like mental health stuff, and we can say, hey, we have this resource. We have, why aren't you sleeping? Oh, you need a shower. Like they have that hands-on doula that can watch, observe, let mom do what she needs to do, and then come back because not everyone has family, not everyone has support. And then having access to a doula really, really benefits them, especially through Medi-Cal right now. So sorry about that. I wanted to just jump in.